Hi everyone, my name is Rachel Booth and I will be presenting on the concept of symptom clusters and how the symptom management theory applies to this concept. A symptom is defined as a subjective experience reflecting changes in the biopsychosocial functioning, sensations, or cognition of an individual. Typically, the more symptoms occurring at the same time, the poorer the patient outcomes. And also, symptoms, no matter the severity, can cause distress and impairment of one's daily functioning. Most of the research thus far has been done with cancer patients because both the disease process and treatment regimens can lead to distressing symptoms. What is a symptom cluster? A symptom cluster is a stable group of two or more concurrent symptoms that are related to one another and also independent of other symptom clusters. These symptoms may or may not share the same etiology. Typically, symptom clusters can differ among individuals, but they tend to occur by cancer type and also treatment regimens. Currently, there is no criteria for defining which symptoms are specific to each symptom cluster. Certain symptom clusters have been associated with poorer patient outcomes, declines in functioning, and also poorer quality of life. For example, breast cancer patients have a higher occurrence of the pain, depression, and fatigue cluster, and this is a highly distressing cluster according to the experience of patients. Recent research has focused on these subgroups of patients that can be identified as an at-risk population for developing certain types of symptom clusters with a high grade of severity and distress. As the research continues to explain symptom clusters, concepts such as these subgroups are important in order to begin research onto how to best treat and also prevent these clusters. Current trends in symptom management. Symptoms have typically been researched, acknowledged, and treated on an individual basis. The standard of practice in medicine is to control symptoms with pharmaceutical means, but because these symptoms can occur in clusters and they can influence each other strongly, they really need to be treated together in order to have the best results and patient outcomes. I have researched the use of the symptom management model and its uses to better assess and treat distressing symptoms. The theory was developed by nurses and takes into account many domains of the patient's experience that lead to how they perceive their symptoms. As by definition of symptom, this theory is based on the patient's subjective reports. This approach is grounded in nursing theories, but has a generally holistic approach to management and its applications. This holistic approach is strongly patient-focused and reflects on the patient's interpretation of what they're experiencing. As you can see, it has psychological, physiological, and behavioral components that are all integrated into this model. The model is based on the thought that in order to effectively assess, treat, and manage symptoms, there are three dimensions that must be considered, and those are the patient's experience, the symptom management strategy, and the resulting or desired outcomes. I find this model to be really interesting and comprehensive because it does take into account three nursing domains as contextual variables. They can all influence the different dimensions of the patient's symptoms. These variables are the environment, health and illness, and also the person. The symptom management model has 6 assumptions. First, the gold standard for studying symptoms is based on the patient's perception, and this includes their experience and also their self-reports. The second, the symptom does not have to be experienced in order to use this model for a preventative approach. This means it can be used to assess for risk factors. The third, for patients unable to express their experience, a caregiver's perception and subjective description can be used. Fourth, all bothersome symptoms must be managed in order to have the desired effects. Fifth, management strategies can be targeted at the patient, the family, a group, or even the environment. And the sixth, symptom management must be viewed as a dynamic process that can be modified not only by the patient's desired outcomes, but also the influences of the nursing domains. The domains are, like I discussed earlier, person, environment, and health and illness aspects. So some implications for practice. Research is really needed to better define symptom clusters and also to develop some criteria for each cluster. As I discussed earlier, there are studies that show that, for example, breast cancer patients are more susceptible to the pain, fatigue, and depression symptom cluster, but there isn't clear information or research done on why that is, or if there are any other symptoms that go along with that cluster. The symptom management model is a very valuable piece for assessments, and this is because it includes subjective and objective characteristics. It also includes the patient's desired results, and also symptom management in this model is viewed as a dynamic process, and therefore the care plan can be ever evolving. Also, interventions can be prioritized in order to maximize the patient's health outcomes. So a final implication for practice is my project idea. And this would be to develop a screening or assessment tool for symptom clusters in cancer patients. It seems like it would be a great opportunity to assess physiological, psychosocial, and emotional factors all in the same tool. The tool could be modified using the existing research to individualize screening to patients by accounting for their specific disease process and also their treatment regimen that they're going through. This would obviously take some time to develop and would require extensive validity and also reliability research. And this is my reference page, so thank you very much for listening, and I hope to see you all soon.